I want to tell you about a breakthrough that could change how we fight breast cancer. What if a simple blood test could tell doctors exactly which treatment will work best for you? What if it could detect cancer coming back over a year before you'd feel any symptoms? This isn't science fiction, it's happening right now. And it's called the Breast Circulating Methylation Assay, or BCMA. This test represents something researchers have been chasing for decades: the ability to identify breast cancer's type from blood alone, without invasive biopsies. The BCMA test does something remarkable. When researchers compared it with tissue biopsies taken 5 years apart, the blood test provided more information than the invasive procedures. In 8% of samples, tissue biopsies showed cancer had switched from one type to another. But the blood test revealed something the biopsies missed. Both types of breast cancer were present at the same time. This matters because about 20% of advanced tumors switch type during treatment, causing therapies to stop working. The blood test catches these changes as they happen. But BCMA isn't working alone. Another test called circulating tumor DNA, or ctDNA, is detecting treatment resistance before disease progression. The SERENA-6 study showed that this test can identify specific mutations, called ESR1 mutations, that cause patients to stop responding to common drug combinations. The results were striking. 99% of patients who had no ctDNA in their blood remained relapse-free after more than 2 years. Think about what that means. Doctors can now see resistance developing and switch treatments before the cancer gains ground. The blood test also picked up more samples as HER2-positive than tissue biopsies did. This is crucial because HER2-positive cancers respond to specific targeted treatments. The test is nearly 90% accurate in detecting when cancer types change. More accurate detection means more patients getting the right treatment at the right time. For patients with triple-negative breast cancer, the most aggressive form, researchers discovered that simple immune markers in blood can predict who will respond to immunotherapy. They measured something called the neutrophil-to-lymphocyte ratio and absolute lymphocyte count. These are just different types of white blood cells. In a study of 372 patients, those with high neutrophil-to-lymphocyte ratios or low lymphocyte counts were significantly less likely to respond to treatment, combining immunotherapy with chemotherapy. A simple blood test taken before treatment started could identify which patients needed closer monitoring. Perhaps most exciting, ultra-sensitive blood tests can now detect signs of breast cancer recurrence over a year before symptoms appear. When cancer is caught this early, treatment is much more likely to destroy it completely and stop it from spreading to other parts of the body. Once cancer spreads, it becomes incurable. These tests are giving doctors and patients something invaluable: time. Time to act, time to adjust treatment, time to fight back before cancer gains the upper hand. These blood tests are transforming breast cancer from a disease we react to into one we can anticipate and outsmart. They're making treatment more personal, more precise, and more effective. For the first time, doctors can watch cancer in real time through blood samples, adjusting treatment as the disease changes. That's not just progress. That's a fundamental shift in how we fight cancer. And it starts with a simple blood draw.